What do I do if I have a subluxation? So this video is point number 10 from our Dirty Dozen health tips from the Remarkable Practice. And look, what do you do when you have a subluxation? So people do lots of stuff, right? Like just a couple of people this morning I was talking to, it's like, you know, I feel like I'm getting old, I'm working out, I added a new thing to my workout and my back's gone, it's pretty sore. You know, I came in a couple of weeks ago and my upper back's much better, and it's like, well, you can stretch it, you can take medicine, you can rest, you can have a massage. But if pressure's on a nerve because your spine's not moving properly, having it adjusted is probably the shortest path to getting better. Now, who can do that? Generally, it's a chiro. Sure, you have people that crack their own backs and their own necks, but generally what happens is they need to do it more and more and more, and they get less and less and less results. Like, they don't get the same relief. And then it gets really tricky to fix because they've got an area that's stuck. Everything else is moving really well because that's the part that pops and makes noise. And the part that's stuck just gets more and more stuck, and it's difficult to correct, and it leads to degenerative change over time. The research shows that. So when you have a subluxation, you should get checked and adjusted where you need it at the level of the subluxation. Now, you could say it's a fixation, you could say it's a tight spot, you can say it's a sore spot. We just use the word subluxation because at least it's consistent. And so if you have an area in your spine that's interfering with nerves, muscles will generally get tight. Over time, they get contracted, they become gristly, you get scar tissue building up, and it affects movement patterns. These things are measurable over time. Having the adjustment where you need it can restore movement, restore nerve function. You're causing all the synapses at that joint to fire and reset back to its original genetic state. And what happens is you get healing occurring. Like I said, massage will give you relief, stretching will give you relief, yoga, Pilates, and they're all good things, and I recommend them for whoever wants to do them. I do them, I think they're great, but nothing, in my opinion and my career, my experience, will give you the same results as having an adjustment when you need it, where you need it. Food for thought. I'll see you at your next visit.